What if I told you that high blood pressure can silently damage your brain, heart, kidneys, and eyes without causing a single symptom? Every year, thousands of people ignore dangerously high blood pressure because they feel fine until they suffer a stroke, heart attack, or other life-threatening emergency. In today's video, we'll discuss when high blood pressure becomes an emergency, when you should go to the hospital immediately, what doctors will do once you arrive, the normal blood pressure ranges, treatment options, risk factors, and how to keep your blood pressure under control. What is a normal blood pressure? Blood pressure is measured using two numbers. Top number, systolic, the pressure when your heart pumps blood. Bottom number, diastolic, the pressure when your heart relaxes between beats. Normal blood pressure, normal, less than 120 over 80 millimeters of mercury, elevated 120, 129, and less than 80. Stage 1, hypertension, 130, 139 or 80, 89. Stage 2, hypertension, 140 over 90 or higher. For many older adults, blood pressure goals may be individualized based on age, frailty, and other medical conditions. But many healthcare providers still aim for less than 130 over 80 when it can be achieved safely. When should you go to the hospital? If your blood pressure reaches 180 over 120 millimeters of mercury or higher, wait about 5 minutes, sit quietly, and measure it again. If it remains that high, it requires immediate attention. Go to the emergency room immediately if your blood pressure is 180 over 120 or higher, and you have symptoms such as severe chest pain, difficulty breathing, sudden weakness or numbness, trouble speaking, vision loss or blurred vision, severe headache unlike your usual headaches, confusion, loss of consciousness, seizures. These symptoms may indicate a hypertensive emergency where high blood pressure is actively damaging organs such as the brain, heart, kidneys, or eyes. Do not try to drive yourself if you're having stroke-like symptoms or severe chest pain. Call 911 or your local emergency services. If your blood pressure is 180 over 120 or higher but you have no symptoms, contact your healthcare provider right away for urgent guidance. You may still need prompt evaluation, but not everyone without symptoms requires emergency IV treatment. What happens at the hospital? When you arrive, the medical team works quickly to determine whether your high blood pressure is causing organ damage. You can expect repeated blood pressure measurements, continuous heart monitoring, electrocardiogram, ECG/EKG, blood tests to evaluate kidney function and possible heart injury, urine testing for kidney involvement, chest X-ray if heart or lung problems are suspected, CT scan of the brain if a stroke or bleeding is suspected, eye examination in some cases to look for damage to the blood vessels in the retina. The goal is not simply to lower the blood pressure, it is to determine why it is high and whether any organs are being affected. How is extremely high blood pressure treated? If doctors determine you have a hypertensive emergency, you'll likely be admitted to the hospital. Treatment may include IV blood pressure medications that work quickly and can be carefully adjusted, oxygen if needed, treatment for the underlying cause such as a heart attack, stroke, or kidney problem. Frequent blood pressure monitoring. Doctors generally do not try to lower blood pressure too quickly because a sudden drop can reduce blood flow to vital organs like the brain, heart, and kidneys. Instead, they lower it in a controlled, monitored way. What causes high blood pressure? Many different conditions can raise blood pressure. Common causes include family history, aging, obesity, high sodium diet, lack of exercise, smoking, excess alcohol, chronic stress, diabetes, high cholesterol, kidney disease, obstructive sleep apnea, certain medications including some NSAID pain relievers, steroids, decongestants, stimulants, and some hormonal medications. Recreational drugs such as cocaine or methamphetamine can also cause dangerously high blood pressure. Sometimes no single cause is identified. The risks of uncontrolled high blood pressure. High blood pressure is often called the silent killer because it may not cause symptoms until serious damage has occurred. Untreated high blood pressure can lead to stroke, heart attack, heart failure, kidney failure, vision loss, dementia, and cognitive decline, peripheral artery disease, aortic aneurysm. The good news is that many of these complications can be reduced through proper treatment and lifestyle changes. How can you lower your blood pressure? You can reduce your risk by taking prescribed medications exactly as directed, Reducing sodium intake. Eating a heart-healthy diet such as the DASH eating plan. Exercising most days of the week. Maintaining a healthy weight. Limiting alcohol. Quitting smoking. Managing stress. Treating sleep apnea if you have it. Checking your blood pressure regularly at home and sharing readings with your healthcare provider. High blood pressure doesn't always announce itself with warning signs, but the damage can begin long before you feel sick. Knowing your numbers, recognizing emergency symptoms, and seeking care promptly when needed could save your life or the life of someone you love. Sources. This information is based on guidance from the American Heart Association, AHA, the American College of Cardiology, ACC, the National Heart, Lung, and Blood Institute, NHLBI, and the Centers for Disease Control and Prevention, CDC. This video is intended for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your physician or another qualified healthcare provider regarding any medical concerns. If you have a blood pressure reading of 180 over 120 millimeters of mercury or higher with symptoms such as chest pain, shortness of breath, stroke symptoms, severe headache, confusion, or vision changes, call 911 or seek emergency medical care immediately. Never delay seeking medical attention because of information you have seen or heard online. If you found this video helpful, please subscribe, like, share this video with family and friends, and leave a comment below. It doesn't cost you anything to subscribe. Your support helps us continue bringing you reliable medical information that could make a real difference. Until the next video, thanks for watching.